Hi all. In this class, we will discuss what are the different types of implantable pacemakers or existing. Starting with this, we have first type, that is the fixed rate pacemaker. So in this fixed rate pacemaker, it's the same working function what we discussed in external pacemaker. In external pacemaker, we have majorly two classification, right? One is fixed rate pacemaker, another one is demand pacemaker. The same thing here also, we have the first two classification is one is fixed rate pacemaker, another one is demand pacemaker. In fixed rate pacemaker, it is mainly used for the people who have the permanent heart block, because there is a high chance of getting a potential risk of competition between patient natural rhythm and pacemaker impulse. So this could be recommended for only the people who have permanent heart blocks. So that type of people will go with this type of fixed rate pacemaker. So here, once the rate is fixed, for example, say 70 beats per minute, this pacemaker will start to give the impulse continuously, irrespective of what the patient's natural rhythm. So it is highly recommended to go with permanent heart block type of patient. Second one is demand pacemaker. So demand pacemaker, as a name, the word gives the information of what is that, right? So whenever there is a demand, in that case only this pacemaker will get activated, and it will give start to impulse or take over or support the function of the heart. Yes. So what here this pacemaker will look for patient's natural rhythm. So if the patient natural rhythm doesn't function, it have some malfunction, or it doesn't work properly, in that case only, so it will look for RR intervals. So if the RR interval is not properly found out, or it doesn't follow proper pattern, in that case only the demand pacemaker will get activated, and it will start to give impulse whatever preset value we have fixed. So in this way we can easily avoid the competition between natural's heart rhythm and pacemaker rhythm. So this is highly recommended for the people who have temporary heart blocks. Okay. So apart from these two, there are other types of implantable pacemaker also there. One such as R-wave ventricular or triggered pacemaker. So here this type of pacemaker is mainly used for the patient who have sinus rhythm with occasional heart block. That means that those people will have normal rhythm. All of a sudden, if the patient, this type of patient will get occasional heart block. So this type or this case of the patient, they will be dealt with using R-wave triggered pacemaker. So R-wave means obviously it is the ventricular. That's why in bracket I have mentioned this is the ventricular triggered pacemaker. Yes. So what is the name itself you come to know, right? The R-way triggered pacemaker means here we are going to use we are going to take the R-way. So whenever the R-way is there, the it's going to trigger the pacemaker. So the pacemaker is going to give the impulse. Okay, that is the R-way triggered pacemaker. But we have to fix a threshold value when we have to trigger the actual value, or when we have to trigger at some other value, right? So for example, if the patient have a normal R-way, if the pacemaker sends normal R-way, it will give the impulse in absolute refractive period. Whereas if it's not sends the R-way, then the unit will take over the function of heart, or it will support the function of the heart. Okay. So it means that here the cardiac pacemaker remains active. Okay. So it will remains active all over the process. It will send the R-way each and every time. It will send if it finds the R-way with a certain threshold, then it will fires the impulse. That means give the impulse in the absolute refractive period. The reason is that when whatever the impulse you are giving at the absolute refractive period, that it will not take out as a impulse by the heart. So without affecting the heart function, the cardiac pacemaker is giving impulse exactly on the absolute refractive period, so that it will no way get interfere with normal heart rhythm. it will in this type of firing in the absolute refractive period is happening only when it has proper RV, when it sends the proper RV. If for example, if the same the cardiac pacemaker if doesn't sense any RV, that is the if, for example there is no presence of RV, then the pacemaker will take over its function. It will continuously give the impulse automatically, whatever preset value we have fixed. So in this way we are going to avoid the competition between natural heart rhythm and pacemaker rhythm. Once again I'm repeating, so RV triggered pacemaker, in this case the pacemaker is remains active for whole the function, for overall function. So what it going to do in order to avoid the competition means, so if there is a RV, it will give the impulse in absolute refractive period, so that whatever impulse you are giving in the absolute refractive period, that it will no way going to interfere with normal heart rhythm. Okay, that is the reason if the RV is there, it going to give the impulse on absolute refractive period. If the RV is absent, okay, it means that this is the time the cardiac pacemaker comes into picture to take over the function or to support the function of the heart. So whenever it sends the absent, then the cardiac pacemaker will start to give impulse continuously in the respective places. Okay, so this is the RV triggered pacemaker. Next is ventricular inhibitor or RV blocked pacemaker. As again the name suggests or name depicts what it means. It's going to stop. Okay, it's going to deactivate the pacemaker when the ventricular is not there. When the RV is not present. Okay, sorry, when the RV is present, the ventricular, the cardiac pacemaker is going to stop. That is the reason of having this title, that is ventricular inhibited or RV blocked pacemaker. So this type of pacemaker we have to use for patient who have heart block with occasional sinus rhythm. So this device is usually suppressed. That means it goes to off state whenever it sends QRS complex, that is a normal always. Whereas when the QRS complex is absent, then it goes to on state and it gives a pulse continuously, whatever the preset value we have fixed. That is what ventricular inhibitor or wave blocked pacemaker. Next type of pacemaker is atrial triggered pacemaker. This pacemaker sends the R wave. Okay, not R wave, is a P wave, because the atrial in the sense it's a P wave. It represents the P wave, that is the atrial depolarization. So atrial triggered pacemaker, this pacemaker is going to sense the P wave, not the R wave. The reason is that that is the type of atrial. Okay, so whenever it sends the P wave, it triggers the ventricular contraction after the suitable PR interval. So that is the reason of using atrial triggered pacemaker. So the advantage of using this type of triggered pacemaker is that it providing maximum augmentation of cardiac output at changing the atrial rate to meet various physiological requirements. Okay, that is the main advantage of using atrial triggered pacemaker. Next one is dual chamber pacemakers. There are some people have problem with SA node. So if you have problem with SA node, obviously the impulse from the, because SA node is a natural pacemaker. If you have problem with SA node, the impulse from SA node to AV node will also be absent. So subsequent bundle of and Purkinje fibers also will not receive any impulse. So when the SA node is it's improper, then all the subsequent nodes will receive the proper signal. So the contraction relaxation of atria and ventricles will be taking place. So the SA node is a natural pacemaker. So if you have problem with the SA node, then in that case you need to go with dual chamber pacemaker, because you need support for atrial contraction and also the ventricular contraction. The reason is that the SA node itself is a problem. SA node have some disease. So in that case you have to go with dual chamber pacemaker. Here the both atrial and ventricular activity are sensed, and based on the requirement are needed, it will give the impulse continuously to have the proper synchronization with upper and lower chamber. So these are the major different types of implantable pacemaker. Okay, so fixed you have nearly 6 type of pacemaker, implantable pacemaker. One is fixed type pacemaker, second one is demand pacemaker, and third one is ventricular inhibitor pacemaker, and fourth one is ventricular triggered pacemaker, and fifth one is atrial triggered pacemaker, and sixth one is dual chamber pacemaker. So these are the major classification you can see in implantable pacemaker. Thank you.